wants to take it so long. Good morning, everyone. Welcome. I'm Bill Danner, and I'm proud to have with me today Chad, who's going to be doing our presentation. I hope everyone's doing well. It's a beautiful day outside, and the weather is just great. Isn't that, Chad? Everything's just peachy in Georgia today. Today we're going to be talking about things that most of our clients always have questions about, and we have our best expert that I know of in our firm and around the middle Georgia area, really, when it comes to Medicare and supplements and Advantage plans and drug plans and all those kind of things. So we're delighted to talk about the ABCs and Ds of Medicare today with Chad Payne. Before we begin, we have a couple of announcements just to bring everybody up to state of where we are and what we're doing in November as far as the firm. And we encourage all of you that would like to participate and also to bring your friends. We really enjoy having your friends participate with us, and sharing our events is always fun for us, and I hope it's fun for them. We're going to have a public seminar here in Dublin at a new restaurant that's got great reviews. It's called Sweetwater Fishery. What is it called?
Saltwater
Fishery. I said Sweetwater, didn't I? Oh, that's me. I always get it half right anyway. Saltwater Fishery. It's a brand new up and coming restaurant, and this is a double tokening event for if you bring friends. So we're gonna shoot for 2 nights. Right now we have 1 night planned. If we get more interest, then we'll add another night. But it's on Tuesday the 10th, November 10th, in Dublin. So if you'd like to attend that and bring friends, you'll get double tokens for doing so for our quarterly drawing, which I'll tell you about in a second. Also on the 12th, we have our first educational event of the month. That's going to be an event sponsored by us, but we're going to have Chef James Baric on doing a virtual meeting on holiday decorating. We've done this before in the past live, but in this instance, we're going to be in his home, and he's going to share with us some decorating ideas, and you'll get to see his home. It's just beautifully decorated. I've never seen anybody do a home with more trees and Christmas decorating. James really likes the holidays, and he'll share that spirit with everyone. So we encourage you to sign up and come and participate with us virtually on the 12th at 11:45. So the 10th in the evening at 6 p.m. in Dublin at the Saltwater Fishery, not the Sweetwater Fishery. You're welcome to bring friends to that. Great evening. We'll be talking about retirement planning and probably post election ideas and things at that point in time. And then on the 12th, all those who do refer us during this last quarter will be entered into our drawing, which will be held before Christmas, a couple of weeks beforehand. So all those who have referred us during the third quarter will go into a drawing for a $100 gift card, which will come in handy for the holidays. So with that said, we're glad to have Chad with us today. So Chad, I hope you got your helmet on, ready to go. And let's talk about the Medicare. So we'll tee it over to you, my friend.
All right. Thanks, Bill. This is the time of the year that's important for everybody that is either in Medicare or about to be in Medicare. We've been able to do this presentation live in the past few years, but for some of you, if you've attended before, there'll probably be a lot of the same information. If you've never attended, it could be brand new information for you as well. But this time of year, if you turn on the TV, you've got a lot to think about and to see there, especially from mostly Humana and United Healthcare. There are a lot of advertising going along there. Even seen Joe Namath doing a couple of Medicare commercials to call 1-800 and talk to somebody. But we're going to try to make this a little more personable, answer hopefully some of your questions along the way through the presentation. But we're also going to be able to answer any questions directly from you through the chat feature. We'll have somebody monitoring that. And I'd like to kind of just go straight on through the presentation and leave some time at the end to answer any questions that may have come up through chat. So also we'll be available to share this presentation. There's some people that have signed up that couldn't attend live, but we'll be able to get that to them as well as anyone else that might request it. We can email them the presentation. So since it's not interactive, I'll probably be able to get through it a little faster. There's usually a lot of questions that go on throughout the presentation, but as I said, we'll kind of hold those or ask those along the way, but we'll answer those at the end. So I'm going to go ahead and get started here in my presentation. Give me a second to get this up. Okay, so we tried to get a catchy title here and use this for a little while, the A, B, C's, and D's of Medicare, because as most of you know, they use a lot of letters of the alphabet when describing a lot of these Medicare plans. So we're going to try to make sense of all of those as we go along today. Our disclosures that we have to provide for each and every presentation that we do. I won't leave that one there too long. You may fall asleep reading that one. Okay, so Medicare, for those of you that don't know, it is basically a program for most people that are age 65 and older. There are requirements that can be met to have it at under 65 if you have certain disabilities. Typically, after 24 months of being disabled on Social Security disability, you qualify for Medicare. Also, individuals that develop ALS or Lou Gehrig's disease or have end-stage renal disease or basically kidney failure can qualify even quicker. Medicare was signed into law back in 1965 to help provide people as they age and as they retire for a source for health care. And it's really grown over those years. Baby boomers have really driven that. There's a lot of people covered under the Medicare program right now. Medicaid, sometimes those get confused a little bit, but Medicaid services they're kind of a partnership between the federal government and your state governments. So they vary slightly from each state to state. One new thing within the last couple of years, I put in here that recipients, most everybody by now have already received, if they've been in Medicare a little while, they received a new Medicare card that has a whole new set of numbers on it. It used to be your Social Security number with a letter behind it, and obviously they decided along the way with identity theft and things like that, it was better to do a brand new number that didn't have your Social Security number tied to it. So if you've been in there a while, you received those over the last couple of years, and then anyone that ages into Medicare gets that from the beginning. All right, so the first letter here, Part A of Original Medicare, your red, white, and blue card. Part A covers hospitalizations. Typically, you're going to have a deductible. Those go up slightly each year. This coming year, I've tried to update all these slides for 2021. That deductible will be $1,408 for up to 60 days in the hospital. That's a one-time cost. It can come into play more than one time a year if you go out of the hospital and come back into the hospital for something different later on in the year. Then you would have to pay $352 a day for days 61 to 90, and then $704 co-insurance after that. And then all costs if over 150 days. Hopefully no one will have to stay in there that long, but also it covers any blood if you needed to have given blood, hospice care, home health care, and then skilled nursing and rehab are covered up to a point of $0 for up to 20 days after you've had a hospital stay. That's kind of a transition to try to get you back home and get you back independent. If you do have to stay in those places longer, you would pay $176 a day for days 21 through 100, and then all costs over 100 days. So inpatient psychiatric care too is available through Medicare, but there is a lifetime maximum of 190 days. And as you can see there in the red, Part A does not cover long-term care. It does give you that skilled nursing, again, to try to transition back, but it's not going to be a permanent long-term care solution or any help on that. Okay, so Part B. Most people that have Part A also have Part B. There are some scenarios where you may not. Part A, I didn't mention, but it actually is covered for free through the paying into the Medicare system over your working life or possibly through spouse's working life. Part B is where we have a cost associated with that. I'll get more details on that shortly, but it's mostly physician and outpatient services that this will cover. Also, labs, diagnostic tests, other things like that, medical equipment, and certain medications that are administered in a physician's office as well. Typically, the way Medicare covers this area is there's a $198 deductible in 2020. That will change slightly. And then you pay 20% coinsurance. Medicare pays 80% for all the covered services under B. So typically at age 65, the entitlement is available for Part A and Part B, either through Social Security or railroad retirement. If you retire there, you're also eligible for Medicare. And it's the first day of the month when you turn 65. So even if your birthday is the last day of that particular month, you're eligible at the very beginning of the month. So then you have a open enrollment period around that, your 65th birthday, which begins 3 months before, and then includes the month of your birthday, and then 3 months after your birthday month as well. That's when you can sign up for any of these other services that we'll be talking about as well. So if you do, for some reason you miss or don't enroll in Part B, say you have, you're still working, you're covered under your medical plan at work. There's people that don't sign up for Part B or don't have to sign up for Part B. You can come back and do that later when you retire. But if you do miss the general enrollment period, that's January 1st through March 31st, you do have to wait in order to do that. So if you do stop working and need to sign up then, and you are going to be losing your health coverage, you do have a special enrollment period that would allow you to join Part B, when you lose coverage, so that there's no gaps in coverage. Okay, so premiums, as I mentioned, for Part B, there are premiums there. Most people pay that through their Social Security checks. If you're not getting a Social Security check yet, you'll get billed for that quarterly. This coming year, 2021, it will increase about 6%. This information just came out in the last few days. Most people will pay $153.30 on that. It was $145 or so last year. If individuals make over $87,000 or joint filers make over $174,000, that number will increase. I've got a chart here in a moment, but the maximum on that is $491 per month if you make way too much money. Here's a chart that shows, this is 2020 chart, so it doesn't reflect the number I mentioned earlier, but it shows you the break points and where your premium might go up. It tops out at $491 per month, and it's going to be $153 for most people though. So different ways you can get Medicare. Obviously, we've gone over here original Part A and Part B. Original Medicare, again, you're eligible for that for most people at 65. There's also other ways, the Medicare Advantage plan, that's also known as Part C. So again, we've got the alphabet going, and that the Part C plans can have a Part D drug plan built into them, and some do not. A lot of them do nowadays. You can also get original Medicare with a Medicare prescription drug plan to go along with it, or a Part D plan. You can also get original Medicare with a Medigap plan or a Medicare supplement plan. There are also cost plans and PACE plans available. Those aren't nearly as popular. Certain areas have some pretty good ones, but we've not really had any in the Georgia area that I've really ever been aware of. Then there's also Medicare and Medicaid plans, are people that might be dual eligible for both Medicare and Medicaid. So A lot of stuff there, a lot of letters again. We're going to go into some little bit of detail on each one of these subsections so we can kind of compartmentalize them and hopefully understand a little more about each one. We're going to start with Medicare Advantage or Medicare Part C. That is what you see a lot of times right now being advertised on TV. Humana, again, I mentioned them. They're all over the place with this. It is basically a private health company that's administering your Medicare Part A and Part B. So that's where Humana comes in, or United Healthcare. There's also Aetna. There's a lot of them in our areas. They come in many forms: HMOs or health maintenance organizations, PPOs or preferred provider organizations, private fee-for-service. Those typically don't have a network. We're not seeing as many of those anymore. Special needs plans, where people may have chronic conditions or special needs for Medicare and Medicaid, and those can be under that umbrella. Medical savings account or MSAs, they don't include Part D, and again, they're not as popular as some of the other plans. Also, employers or union groups can actually build their own and offer that to their retired folks. A lot of folks out there that have teachers' retirement or state retirement, state health benefits in Georgia, when they turn 65, they will have Medicare Advantage plans available to them, but they're not the ones you're typically going to find out on the open markets. They've built them especially for those retirees. So the HMOs, just brief description there. Most of those will be kind of restrictive. You've got to go to someone that's in that network. If you go outside of it, you're not going to have coverage, or it's going to be very limited. PPOs, typically you'll have your network. If you have to go outside the network, you'll still have benefits, just maybe at a slightly higher cost to you. Private fee for service, again, those have been kind of slipping away in popularity, but there's really no network there. You can go see any doctor or facility that is willing to accept the payment from the plan. So to be eligible for a Medicare Advantage plan, individuals, they're entitled to benefits under Part A and enrolled under Part B. As I mentioned earlier, there are some scenarios where people, they automatically enroll in Part A, but they don't enroll in Part B, mainly because they have employer coverage. But in order to qualify for Medicare Advantage, you have to be enrolled in Part B and entitled to Part A. So each of these plans under this umbrella, they must basically cover everything that Medicare Part A and Part B covers. Typically at least as good or better than what Part A and Part B would cover, or else there would really be no reason to do it if original Medicare covered things better than they did. So they're also issued by private companies, as I mentioned, and they're county specific. This is where it gets a little complicated. It's based on zip code. So the one they're advertising on Humana on TV that says, it's the best thing ever, zero this, zero that, zero everything, may or may not be available in your area. You have to look a little deeper before, it sounds too good to be true. Sometimes it may be for your area. But they provide cost sharing that's equivalent to Medicare A and B and under the Medicare covered services. The one big benefit that, in my mind, over just regular original Medicare, they offer a maximum out-of-pocket, which those costs and out-of-pocket costs I went over earlier with just Medicare, those can go on and on and on. You could have multiple deductibles for hospitalization in a year. You could have those 20%. Just there's no end in sight. So Medicare Advantage does give you a maximum out-of-pocket, a worst-case scenario for health coverage in a given year. And everything, deductibles, coinsurance, and copayments, all those kinds of things go toward that maximum out-of-pocket. Now, those numbers have been going up a little bit. They index those for inflation, but still it is a worst-case scenario that you know what it is up front. So when you're if you happen to have to go out of network, though, they do cover emergency surgery or services if you're traveling and you're not in your plan area. and urgently needed services or out of area renal dialysis. So they're designed to be used in your general area, but you can go out of the area for certain things. One other thing that many of these Advantage plans have started beefing up over the last few years are the added or extra benefits. These actually cover things that original Medicare do not cover, like vision services, hearing aids, routine dental, and even some have even more comprehensive dental, transportation, chiropractic services, annual physician exams, safety assessments, emergency services, and over-the-counter drugs in some cases. Also, I didn't list it here, but Silver Sneakers is a big plan that a lot of Medicare Advantage companies have. They give you a free gym membership to participating gyms. All right, we'll switch gears. Keep in line with the alphabet here. We'll go to Part D, or prescription drug plans. It's one of the few that really makes sense. D for drugs, but the qualification and eligibility for it is individuals who are entitled to benefits under Part A and or enrolled under Part B are eligible. So slightly different than the Medicare Advantage, slightly easier to be eligible for, but most people that would qualify for one would also qualify for the other. So for 2021, all the numbers are changing slightly. I hope you can see this slide. It didn't come through extremely well, but our deductible, most plans have a deductible, some do not. You'll typically, if you get one without a deductible, you're going to pay more premium each month. But deductibles can be lower, but most of them are at $445 on a base plan. Then once you pass that deductible, the initial coverage will be 25%. That's what you would pay. It would cover 75%. Now, some of those, a lot of plans come in the form of a copay in this coverage area. So you may actually get a little better deal than, you may even pay less than 25% if it's just a flat copay. Some plans are a flat percentage. Also in the deductible area, a lot of plans, if you have a tier 1 or 2 generic, the deductible doesn't apply. So you get the initial coverage kicks in immediately. For more expensive tier 3 and above drugs, you'll have to meet that deductible first. If you have over $4,130 in total drug costs, the initial coverage ends and you hit the coverage gap, or the donut hole as it's known. In that part, you will pay the 25%, and then the cover between discounts and other coverage will fill in the 75%. Now, this is technically the coverage gap is gone because, as you can see, the percentages match the initial coverage and the coverage gap. Years ago, the coverage gap, you had zero coverage. You had to pay 100% out of pocket, but now it mirrors the initial coverage. People that do get into this, though, may see their prices go up some, especially if they have a plan that in the initial coverage has a flat copay. Say it's a $7 copay. Then you hit the coverage gap, and all of a sudden you have to pay the 25%. It may go up to $10, $15, $20, whatever the percentage of that cost is. So even though it's technically the same, you can see some increase. Then if you do get to the point of a total out-of-pocket of $6,550 in drug costs, then you hit the catastrophic phase, which you only pay 5% of the drug costs at that point, and there's 95% coverage. That's a double-edged sword. It's great that you only pay 5%, but you've had to spend a lot of money, unfortunately, to get there. Some experimental drugs are very expensive. Non-generic drugs can get you into that if you're not careful there, but hopefully that won't apply to very many people. Okay, so just to recap and kind of compartmentalize again, original Medicare has Part A and Part B. Part A is hospital coverage and inpatient care, also long-term care facilities for a short period of time as you transition. Part B is doctor services and outpatient services covered under that. Part C is a Medicare Advantage that basically is a private company administering Part A and Part B for you. And then Part D is a standalone prescription drug plan that typically would be used when using original Medicare Part A and Part B. All right, this is a confusing part as well, but some of them are not, but there are a few other periods of enrollment that are available that aren't top of mind. Right now, we are in the Medicare Advantage annual election period, AEP, and that goes from October 15th through December 7th. So let's see if we can follow the thing here. Annual election or annual enrollment period. That's what we're in right now. So any Medicare enrollees are able to change plans for Medicare Advantage, Medicare drug plans, or if they've not chosen one of those before, they can choose one for the first time during this annual election period. And again, October 15th through December 7th. There's a Medicare Advantage open enrollment period that's January 1st through March 31st. You can make a one-time change to a Medicare Advantage plan if you did not before during the regular annual enrollment period. So there also can be some special enrollment periods for people. Maybe during the year, you may lose employer coverage, for example, or lose other medical coverage that you've had. You would have an opportunity to join any and all these plans at that point, even though you may have passed your 65th birthday. So the general enrollment period, if you missed, I'm kind of going backwards on this chart, but if you did not enroll in Part A and Part B, or Part B specifically, during when you turn 65, you could do that between January and March of each year after that. And typically, the initial enrollment period, we touched on that earlier, that would be when you're turning 65, 3 months prior to your birthday month, the month of your birthday, and then 3 months after to enroll in Medicare Part A and Part B. Okay, so we'll talk about now the Medicare Supplement Insurance, or Medigap policies, as they're also known. These would be used in conjunction with original Medicare A and B. So what they've been around a long time. They're sold by private insurance companies, Mutual of Omaha, Aetna. There are a lot of companies that offer these, and they've been around a long time. They're very steady on the benefits that they offer. They also have a letter of the alphabet associated with the type of coverage, and I'll show you that in just a moment. But there's, again, they fill in the gaps for original Medicare. That's why Medigap is one of the names they're known by. But it does work with original Medicare. In this situation, it would cover all, or in most cases, a portion of what is left behind by normal Part A and Part B. So those deductibles and the 20% co-insurances that I mentioned earlier when I was going over Part A and Part B, the Medigap plans will cover either all or a portion of those for you. So some Medigap policies cover benefits not covered by Part A, but typically they mirror exactly. If Medicare covers it, the Medigap covers it as well. But you can get, with some plans, foreign travel, emergency care, and extra days of coverage that Medicare doesn't offer. Here's a chart. Again, we've got plan A, B, C, D, F, G, K, L, M, and N, all available. I would say the most popular plan for me and for most people that I know is the plan G now. Plan F used to be, because it covers, as you can see, 100% in every category. Plan G covers 100% except for the Medicare Part B deductible, which is $198 that we mentioned earlier. So You have to pay the $198, but then everything else is covered after that. And what we're seeing with, well, F plans, they've made some changes. Anyone aging in that's turning 65 cannot get an F plan anymore. That started in 2020 at the very beginning of the year. So very limited people can even receive or get an F plan. A lot of people still have those, but Plan G has become more popular, and the premiums are very favorable comparing to Plan F now. Okay, so Medigap open enrollment periods. There's, again, about a 6-month period around one side or the other of your birthday month for turning 65 or joining Medicare. So you have a guarantee issue period for these with no medical underwriting. That means, you don't even have to answer any health questions on these. So that makes it nice for a lot of people. You can change Medigap policies in the future, but with some caveats that I'll get into shortly. But they typically, you may be able to buy a Medigap policy at any time, as it points out here, but the insurance company has to approve you if you don't do it in your open enrollment period. In other words, at that point, after that 6-month period, you can choose to try to buy one, but you do have to answer health questions at that point, and they can turn you down. That's why it's kind of important to know your options and make a good choice when you are aging into Medicare, is you have all your options available to you with really no questions asked. So the guarantee issue period is a special right during open enrollment that our state and most states have. You can also, there are some scenarios where if your Medicare Advantage plan that you already have, if it doesn't renew in your area, you actually have a guarantee issue period for a Medigap supplement policy. So that's every now and then that comes into play where people realize that, hey, I'm getting a little older. I need to, I'm using healthcare more. Maybe I'll look into a Medigap or Medicare supplement policy instead of the Medicare Advantage. So if you do leave an employer, you also, if you're say over 65, maybe 67, and you retire, then you do have a period of time, if you're losing employer coverage, to also join in a Medigap plan with no questions asked, have a guarantee issue period. That happens with a lot of people that work past age 65. So as long as you've been covered by another plan, you can get on board a Medigap policy with no questions asked at that point. So, all right, what's new for 2021? Not a whole lot. A lot of Medicare Advantage plans are offering new plans in some areas, but for the most part, you're getting at least as much or more than last year for about the same premium in general across America. They are using increased telehealth services with Advantage plans. The COVID era that we're living in right now, it makes a lot more sense to do the telehealth. It's cheaper for most of the plans to administer as well, and saves you money as well. So you can access those services, either phone calls, Zoom meetings. There's a lot of different ways to talk with a physician and have a checkup done, electronically, basically. Medicare Advantage plans in a few more plan options and typically a little bit lower cost in most areas. This is an area that is new. Many plans will offer insulin at no more than $35 per month, and in some cases it's even lower than that. That was some legislation that was signed into, maybe even been an executive order done recently that would lower that cost. Insulin, a lot of folks depend on insulin, and it can be very expensive. That's going to help a lot of people out. All right, so that was pretty quick, going through a lot of things there. And you can see my little meme there. There's a lot of information. I'm sure we've got a lot of questions. Hopefully I've answered some questions along the way as well. But I did want to kind of just recap, again, that was a lot of stuff thrown at you, but this is a good little chart that just shows a couple of different paths. So if, say, you're aging in or you're eligible for Medicare, a couple of different paths you can go. You can go to the left here, original Medicare, A and B. You're going to get that typically because you're eligible from working and paying into the system. The Part B you'll pay for. In any of these scenarios, you're going to pay that Part B premium no matter which direction you go. So you can't avoid that for most folks. Then if you go that on the left, you can then choose a Part D prescription drug plan. I failed to mention earlier, if you're eligible for Medicare and you don't choose a Part D prescription drug plan, you actually will have to pay a penalty in the future when you do decide to join a prescription drug plan. So typically for most people, if they're not taking many or any medications, it's still wise to join a drug plan when you're first eligible. And you can get some really inexpensive ones now that, maybe $13 or so, that, you can mark your spot. And in case your drug, you do have to take different drugs during the course of that year, you don't have to wait to join a plan, and you don't get penalized to join a plan in the future. You can also add the Medigap or Medicare supplement policy with original Medicare and the Part D plan. Medigap's just what we just went over. So the Medigap plans are a good bit more expensive each month than the Medicare Advantage plans. But as we showed in that chart earlier, it's going to cover, almost all of your out-of-pocket expenses for medical. So you pay a premium every month, but you really don't pay anything as you use it. So if we shift to the right-hand side of the chart, the Medicare Advantage plans, you're going to typically purchase one of those from a private insurance company. They will start administering your Part A, Part B, and in a lot of cases, Part D, all under one umbrella. Typically, these will have low cost associated with them, in some cases even zero premium, other than your Part B premium that everybody has to pay. But you will have associated costs every time you do use it. So you'll pay as you use it, pay as you go in co-pays for services with doctors, services at hospitals and things like that. So, and they do have that maximum out of pocket, as I mentioned, as one of the main benefits. And they can also have a lot of ancillary benefits that Medicare doesn't cover: the vision, the dental, the free gym membership, things like that. So that's hopefully you can have those a little straight in your mind there, because there are a lot of letters there that we've gone through and a lot of information as well. So that pretty much concludes what I've got to present today. Again, we can get the slides out to everyone that wants them. If we want to get that out, people that weren't able to attend live, as well as anyone else that might want to see that. So hopefully that's been some good information for you guys. And I'm not sure if there are any questions that we've had along the way. Bill, have you seen any of those?
Not yet, but we are making available the slide presentation. If anybody wants that, you can download that. For many of you on the line, if you have medical insurance through your former employer, that's a blessing. You are still probably will be or are enrolled in A and B. So your former employer plan then becomes your supplement. In the case of some of the state federal employees, they mandate you do an Advantage plan, which coordinates, as you mentioned before, Chad. So if some of you have a health insurance plan from a former employee and don't understand how it works with Medicare, you can give Chad a call and he can probably help you get through that. But basically, primary is always Medicare A and B, and your retirement plan or your supplement or your Medicare Advantage plan becomes your supplement to what A and B does not pay. We thank you all for attending. Chad, do you have any other comments? We don't have any questions.
Yeah. Okay, I did have a couple things. This is all a lot of information, as I said. If you do have any questions specifically for you or a loved one, possibly, feel free to give me a call. We do offer plans for Medicare Advantage through Humana, United Healthcare. Aetna as well, and also Medicare supplements through a variety of companies as well.
And plans.
Plans, right. So I can help out, with questions there, checking into what medications are covered under any of these plans, and help you enroll if need be. Also, topic for another day, but we're getting close to Affordable Care Act, ACA health plans for folks that are typically under 65. Also have things available in that area too, and pretty good expertise when it comes to that. So if that doesn't apply to you, you may know someone that could apply for, and you could give us a call as well.
All right. I think we do have one question here. Who's the question? Jean Haygood. She has a question. We're ready for your question. She's a federal retiree, so well, I guess she doesn't have we don't have the question. I guess we can call her, whatever we have to there.
Yeah.
But anyway, thanks everyone for your morning. You're spending some time with us, and Chad, thanks for the information. Again, we want to assist you in making decisions along these lines because they're important to your financial well-being, and especially the care that you get as you age. It's important to have good health care in place, and we try to get the best supplements and plans available to help people supplement their care. Thanks again. Y'all have a good week. Look forward to seeing you in a week or so. If somebody wants to come to the saltwater fishery, just make sure you reply to that, and we'll see you soon. Thanks very much.
Thanks.